Debridement refers to a surgical procedure where non-viable and necrotic tissue is removed. We call that, in other words, the non-viable necrotic tissue is debrided away. It is removed from the body. So in general, the human body prefers to heal acute, fresh, healthy wounds where there are minimal bacterial counts and no dead or necrotic tissue. So in order to encourage wound healing, we often need to perform debridements where we surgically remove all of the dead tissue, the non-viable tissue, and decrease the bacterial colonization or the bacterial load on a wound. And that is what debridement is. Oftentimes the wound after debridement, it looks beautiful to us because we know what a healthy, clean wound looks like, but it may look larger and worse to patients after a debridement. So you have to trust us that the wound needed to in fact become larger, because the reason the wound looked smaller was because there was a bunch of dead and non-viable tissue present. And the debridement will remove that non-viable and dead tissue, which can make the wound become significantly larger, but this is a necessary part of the process to achieve final wound closure and healing. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.